We would like the names of the personnel at CMS who you provided the risks that you identified in your analysis of other contractors' code. Can you do that?
Yeah, let me follow up with you on that.
Yeah, that's fine, for the record. And what I'm going to encourage my colleagues to do is ask for names. Because this amorphous CMS is, there are people there. And I'm going to venture to guess that the regular bureaucrats did their job. The political appointees manipulated the system to hide data they didn't want the public to know. And we're going to find out who that is, because that's the crux of this problem. I've got a letter from a constituent who basically says, we have never been without health insurance. However, the Affordable Care Act may force us into the position of going without it. This whole battle is about whether Americans can have affordable health care. And this system is not helping in this debate. And I just want my friend Mr. Pallone, my friend Mr. Gett, I was ranking member when this bill got passed and signed into law. After it got signed into law, we had 13 subcommittee hearings on things like smokeless tobacco, antibiotic resistance, health care pricing, national all-scheduled electronic reporting authorization. Each one of those, I asked for a hearing on the health care law. And it's in the congressional record. Statements like, on April 28, 2010, we must hold hearings on the new Health Reform Act. May 6, 2010, we should also call Secretary Sebelius to testify. June 9, 2010, we need a hearing on the new health care law. June 2010, shouldn't the committee hold hearings and take immediate action? My friend Mr. Waxman always sends us letters, I want to do this, I want to do that. We sent countless letters to the Democrat majority at that time asking for hearings on the recently passed health care law, and guess what? No hearings. So when Speaker Pelosi then said, we've got to pass the bill before we know what's in it, we're finding out. We're finding out a flawed tech system that's a mockery. Now let's talk about this. I accept the premise that you tested your individual section. But we are getting to the point of the integrated system. When was the integrated system tested? Go starting with Ms. Campbell down the end of the table. When was the integrated system tested?
During the last 2 weeks in September.
And what was the result of that?
I don't have the results. You'd have to get that from CMS.
And who would I go to get that information? Who is your point of contact at CMS?
So there are a number of people.
Give me a name.
Henry Chow.
Give me another name.
Michelle Snyder.
Got another one?
Peter O.
Okay, Mr. Slavic?
So here's what we saw.
Isn't that a beta test? Wouldn't it put the different components together and see if the system worked?
So here's what we saw. We didn't see the full kind of integrated end-to-end system testing that you're talking about.
Why not?
Until the couple of days leading up to the launch.
Shouldn't we have had that?
Ideally, yes.
Ideally, yes. Wouldn't any other system, corporate entity rolling out something would test to see if it worked before it went out into the field?
Yes.
Yeah, Ms. Slavic, you have names of who you talked to?
I don't have any names with me.
Will you provide those to us?
We'll be happy to follow up.
Thank you, Ms. Belsey.
So we tested.
I know you tested a beta testing end-to-end. When did it happen?
The information only comes to us after the application is completed. So we were testing up to the time that the system went live. And as far as we were concerned, everything that came to us, we were able to process.
Quickly.
Our systems are not integrated with the main system. Our main interaction with it is key entry.
And Mr. Slavic, I'd like the names by tomorrow morning if you could do that. Finally, I want to go back to Ms. Campbell. C Plans First feature that was just changed on the website. Who told you to do that?
I'm sorry, could you repeat that? I didn't hear you.
The See First plans. Remember, the website failed. Part of the problem is people don't know what the cost of the plans are. You all made a change to say See Plans First, just reported yesterday by, I think, CBS. Who made that decision?
I don't know that who made.
Can you give us the names?
We can get you a name.
Okay, who made the decision that if you are younger than 50, you would be quoted a 25-year-old health policy?
I don't have an answer for you,
Can
sir.
you get us a name?
I can try. I can go back to my team to see if they have a name.
Okay, who made the decision that if you are older than 50, you get quoted a 50-year-old policy?
The same. I'd have to go back to my team.
Thank you, Mr. Chairman. I yield back.